The first thing that we wanted to do was to reinforce the use of the CHADS-VASc scheme for risk assessment for stroke in patients with atrial fibrillation. The committee decided that these new anticoagulants should be preferred to dose-adjusted warfarin anticoagulation. We considered the left atrial appendage occlusion device. This may be a good therapy for patients who are at high risk of stroke but cannot take oral anticoagulants. We introduced a new antiarrhythmic drug for cardioversion of atrial fibrillation. This drug, vernacalant, can be used to terminate rapidly early onset atrial fibrillation. We also had to consider some limitations with the drug dronedarone. We made a definite exclusion of this drug for patients with permanent atrial fibrillation and suggested great caution in patients who had mild heart failure.
The atrial fibrillation ablation pilot study has provided the first systematic, prospectively collected data on the characteristics of patients undergoing the atrial fibrillation ablation, the procedures around the actual ablation, and the outcomes in a real-life setting. It shows that this success is slightly lower than in controlled trials, but it's still encouraging. And there are areas where we could improve in the management of these patients, which is in the assessment of recurrences and the treatment, especially the anticoagulation treatment during the follow-up.